thanks to your knowledge, your personal experiences that you're sharing with policy makers, you are ensuring that Lyme disease and other tick-borne illnesses finally are receiving the attention that this growing public health threat deserves. So I congratulate you for that. The incidence of Lyme and other tick-borne diseases has exploded in the past 15 years. In 2003, Lyme disease infected approximately 30,000 Americans. The latest estimates show that nearly 500,000 Americans are suffering from Lyme disease. And we know that's probably understated because so many people don't get a proper diagnosis. In my state of Maine, there were more than 2,000 newly reported cases of Lyme last year. That's nearly triple the number of cases in 2010. Other tick-borne diseases are also on the rise in Maine. For example, anaplasmosis has increased several-fold in this same period. And just yesterday, the University of Maine Tick Lab, a national research leader, proud to say, reported that nearly 40% of the Maine deer ticks that were submitted to the lab last year tested positive for the Lyme pathogen. Think about that. I called up my chief of staff who loves to hunt, and I said, you be really careful to look yourself over and take precautions before you go out into the woods this fall. More than 2,000 deer ticks were tested at this lab, just to give you some idea of the universe. They were from 358 different communities in my state, representing each of Maine's 16 counties. And this worrisome statistic that 40% of those 2,000 deer ticks demonstrates the danger of this pervasive threat to public health. Now, the good news is that so many people sent in the ticks for testing. We held a hearing to try to increase public awareness, and I think the lab's gotten pretty overwhelmed with the number of ticks that have been presented to them. But they are doing wonderful work, for example, with our game wardens that are out all the time in the woods, making sure that they have a little tick kit with them so that it has tweezers in it and has what they need so that they can send in ticks to be tested, and also teaching them means of prevention. Maine has the largest incidence on a per capita basis of Lyme disease in the country. And even Drake's Island is not immune, I fear. Beautiful place though it is. My contractor at my camp at Coldstream Pond, undiagnosed Lyme disease, my niece 3 times Lyme disease. So all of these are examples of why last spring, working with Paula Jackson Jones, working with your group and so many others, I introduced the Tick Act. Now, Sarah gets credit for the name. Ticks, identify, control, and knockout. That's what Tick stands for. And I'm pleased to say at a time when we're so polarized in Washington that the bill was bipartisan from conception. That's the way it should be, because the tick doesn't care if you're a Democrat or Republican or an independent red or a green or none of the above. So the bill is designed to provide local communities and states with resources for prevention, early detection, better diagnosis, and treatment of Lyme and other tick-borne diseases. Now, some of you may remember that I described our bill on a video message for a conference at the Center for Lyme Action hosted last October. And less than a week later, my former colleague and good friend, Senator Hagan of North Carolina, passed away from complications of a tick-borne disease, the Powassan virus. And in tribute to Kay's courageous fight, we renamed the bill the Kay Hagan Tick Act. And I'm proud to report that the legislation was signed into law by the president in late December. So Paula, you never thought it would happen that fast, did you?
No, ma'am, my head's still spinning.
So the Tick Act applies a three-pronged public health approach to address Lyme. It authorizes $150 million over a 5-year period. First, it establishes a national strategy headed by the U.S. Department of Health and Human Services to prevent and treat tick-borne diseases. It also expands research and improves testing and public awareness. Second, the Act funds and strengthens the regional centers for excellence in vector-borne disease, which are leading the scientific response. And finally, third, the law establishes a new grant program for state health departments to help states build public health infrastructure for tick-borne diseases. And I'm delighted that the president's budget includes $14 million that is in the CDC's budget to help in this regard. So that's a great start. In addition to the fiscal and the emotional toll that Lyme disease takes on patients, it's also expensive. So this investment only makes sense. I think of Paula's experience, and you know what a great advocate that she's been. She, I believe, if memory serves me correctly, had to go to more than 24 healthcare providers before she got an accurate diagnosis. And she's still paying off more than $250,000 in medical bills. Medical costs of Lyme disease nationally are estimated at $1.3 billion per year. And that doesn't account for indirect costs, such as missing work, for example. A correct and early diagnosis can reduce costs and also improve the prognosis. But we still have a long way to go, and that's why our new law is so important. When HIV, for example, became a public health crisis, a gold standard for the identification and treatment was developed within 10 years. Lyme disease was identified more than 40 years ago, and yet there still is no gold standard for treatment. We learned that at our hearing. Existing prevention, education, and diagnostic efforts are also inadequate. But with the national effort that the Kay Hagan Tick Act sets into motion, including the allocation of additional federal resources, I am optimistic that we can better protect the health of many more Americans. Now I'm going to give you an assignment tonight, because we've got the authorization in place, and that's the first step. We have some funding in the president's budget. That's the second step. But the third step we're going to need your help on. And that is, we want to now send a letter to the Appropriations Committee, on which I happen to serve, fortunately, to make sure that we're getting funding for all three elements, and particularly those state and community public health grants. I think those are so important along with the research. So as soon as we get the letter written, we're going to ask your help in getting as many senators to sign it as possible before we send it to the Appropriations Committee. And then just start bugging the Appropriations Committee, no pun intended. Start, it really was coincidental. Start bugging them about funding this important law. We've got the framework in place, now we need to get the funding. And with your effective advocacy, what a difference we will make. We will identify, control, and knock out these devastating diseases like Lyme. Thank you so much.
Senator is truly